all of our coordinators and talking about all of the amazing things that all of our different units have done. We've gotten updates from the state level before, but we thought it would be a fun idea to have you guys meet all of the different coordinators from across Virginia. So with that in mind, all of the presenters are going to be either regional or MRC unit coordinators. They'll be introducing themselves and talking about what all of their units have been doing. So we will be starting in the far Southwest because there's a lot going on out there right now. And so Pat, if you would like to go ahead and take it away.
Thank you, Kate. I'm Pat Minen. I'm the new coordinator in Southwest MRC. If you know Christina Morris, she was the coordinator for 20 years at least, and she just retired. Her last day in the office was August 30th. I started as a contractor 2 weeks before that to catch up on everything that's been going on. I worked with Christina and the state MRC for 2 years during COVID. So I spent a couple weeks with Christina catching up on what was going on. She left the office August 30th, and then for a couple weeks, everything was going fine. I was getting into a good routine, and then Hurricane Helene hit us. So I have a couple pictures to share if it'll let me. Let's see. Did that work? Can you see my screen?
Yes, we can.
It's acting like it's not doing, there it goes. Okay. So Hurricane Helene came in on September 27th and flooded a number of areas. This is in Damascus, which is we also had flooding in other areas of this is in Galax, which is an hour and a half from me. I live in Bristol and work in Abingdon. So Damascus also, Galax was also flooded. This is in Freeze, which is in Carroll, Galax counties. That bridge right there was actually eventually flooded and a lot of debris was stuck on the bridge, but the bridge survived. So as soon as the storm hit, that first day, we opened shelters in Bristol. We eventually had shelters in Wytheville, Marion, and Galax. And we had volunteers at all those, even night shifts, medical, non-medical. We had quite a bit going on. Water distribution, we had volunteers go out and do well checks. We had some volunteers come from Virginia Beach and the peninsula to help in Galax because we have volunteers who are nurses in the Galax area, but they had no electricity, water, or internet. So they couldn't either get our alerts or didn't want to leave their houses. So then we set up mobile vaccination units. We had volunteers helping with that at a couple locations. We had distribution centers set up where volunteers help take in donations and give them out and register. We now have volunteers at disaster recovery centers in Independence, Galax, let's see, Marion, and we're opening one in Tazewell and then Wise in the next couple days. So we still have a lot going on that'll probably last for several more weeks. Let's see if I can stop sharing. So in addition to that, we have, oh, thank you. In addition to that, we have, we're still trying to keep the regular things going. We've had volunteers do just over 500 hours now, just for the Hurricane Helene response. But we also have volunteers who are teaching Stop the Bleed. We have a CPR class this Saturday that a volunteer is teaching. We have Drug Take Back in a couple weeks where we go to different locations with the local law enforcement to collect prescription medications that people no longer want, so they're not out there. So we have a lot going on, and we're trying to do even more, and hopefully the hurricane response will be done in a couple weeks, at least from our point of view. I think that's all I have for you.
Great, thanks, Pat. All right. So now we're going to go just a little further east to the near Southwest with Mary.
Hi, you guys. My name is Mary Lou Legg. I am the coordinator for the Near Southwest Medical Reserve Corps, and I've been with the Medical Reserve Corps since 2018. And when I'm not coordinating volunteers, I spend my spare time volunteering. So I volunteer for a couple organizations locally, Pathfinders for Greenways. I serve on their board and I also serve on the Blue Ways Commission board here in Roanoke. I also serve as a director with the National Ski Patrol, which I've been with for almost 30 years. The Near Southwest, geographically, if you look at us, our unit alone is the largest geographic unit in the state. We cover 5 health districts, including Central Virginia, New River, Pennsylvania, Danville, Roanoke City, Allegheny, and West Piedmont. We also have 2 district level coordinators who help me out a great deal. We have Josh Cassell in Pennsylvania, Danville, and Susanna Marley in New River. Our unit's staying pretty busy lately. We are currently supporting a lot of population health and EP&R outreach events. We've been helping with Revive and Stop the Bleed trainings. Volunteers have also been helping both EP&R and nursing at flu clinics. And we've been supporting a lot of administrative support requests. We have also been working with our community partners as well. We recently provided moulage support for the Roanoke-Blacksburg Regional Airport drill. And our team in New River recently got to practice working a triage area during an active shooter drill. We also have volunteers down in Pennsylvania, Danville, getting ready to help with an upcoming 5K race. Something unique about our unit, we've been working the past few years, working with community partners of emergency management to develop a community animal shelter team. And that team does additional training. Those volunteers have helped with exercises. And the goal is that those volunteers could support a co-located pet shelter that would be set up next to a human shelter during a disaster. And that's a little bit about us.
And unmute is very important. So we're going to go to the Northwest region now, and we're going to start with Chris.
Okay. Apologies if everybody just heard me clear my throat. So my name is Chris Reaney, and I am the unit coordinator for the Central Shenandoah Medical Reserve Corps. So we cover Central Shenandoah Health District, which is made up of Harrisonburg City and Rockingham County in the northern part of our district, Bath and Highland County, which are in the mountainous area bordering West Virginia, Stanton, Augusta, and Waynesboro, which is kind of in the middle, and then Lexington, Rockbridge, and Buena Vista, which are on the border with Mary Lou's region. So it's also a pretty big area for one district. And I actually used to be the coordinator for the Lord Fairfax Health District and Blue Ridge Health District back in the day, up until 2022. So if any of you from Blue Ridge or Lord Fairfax recognize me, yes, it's still the same guy. But now I get to focus on Central Shenandoah. So we have been keeping somewhat busy over the last year, not nearly as busy as Pat has been in the last few weeks. But we have been getting volunteers engaged in supporting the health department offices on a more routine basis with a recurring training day for our staff that we have on the 3rd Friday of almost every month. So we've had volunteers come in to help with front desk coverage for that. And it just gives us an opportunity to kind of, get people to know each other and get to know, how the health department kind of interfaces with the community on a daily basis by directing calls and taking messages for clients that come in for services on those days when our staff are in training. They've also been supporting the WIC Farmers Market that we were having every Friday morning during the summer up until September 13th. And they supported the remote area medical clinic, which for Central Shenandoah, we've been doing over the last couple of years a clinic within a clinic. So we have a variety of vaccinations that our district will offer at those RAM clinics. And we had 18 volunteers supporting that event over 2 days. So it's definitely the most, the largest deployment that we had this year so far. We've also supported things like Rapid Revive at community outreach events, public health kit building for population health outreach, school immunizations clinics in the schools in Rockingham and Harrisonburg. And let's see, we also had 7 volunteers helping out with registration and moulage for an airport full-scale exercise in our area, Shenandoah Airport. So that was pretty significant. That was September 21st. And we had a great turnout at our Northwest Region MRC Competency Camp. We had 8 fantastic volunteers show up, and we did a variety of training on the health department's role in public health, as well as what to do if you're in the midst of a mass casualty event, and how to stop the bleed, how to use tourniquets, how to apply pressure to bleeding. So future plans include more cross promotion with our population health team at Central Shenandoah to recruit volunteers and get them involved in supporting population health, as well as starting to provide recurring training opportunities for CPR, stop the bleed, and psychological first aid. So that's it for us.
Great. Thank you so much, Chris. Let's go to Amy.
Hello, all. I hope you're doing well, and we are definitely not as busy as Southwest, thank goodness, and hopefully they're doing much better down there. I am Amy Lane, and I am the MRC coordinator for Blue Ridge Health District. In Blue Ridge Health District, we serve Charlottesville, Albemarle, Greene, Louisa, Fluvanna, and Nelson counties. So it's a pretty big area. We have quite a few things that we do. We keep very busy. We have some very rural areas and obviously some very not rural areas that we keep urban and keep very busy. Most importantly, things that we have done is we've been ready for our community. We've had several times in the last year where we've been called to the ready. We've had wildfires in Louisa and Greene counties, protests at UVA, and boil water orders for Louisa, Fluvanna, and Albemarle. None of them needed further deployment. So none of our MRCs none of our MRCs deployed, but they did answer the call and had readied themselves to serve when and if it was needed. So that was really significant for us. We have a lot of normal business at the Blue Ridge Health District, things that we do every single month or quarterly. We have our OSS long-term staffing. This is a monthly public-facing position where they conduct light office duties, answering phones, greeting people, taking messages, filing, making charts, copying, etc., etc. WIC lab assistant is a monthly finger stick or heel stick with the lab work, weights, heights, and lengths during our WIC clinic, which is really popular and really fun. We have a monthly revive for our community that is led by our MRC people, which is fabulous. That is at both Fifeville and at the Haven. We have several health fairs that we've done this year, including Healthy Baby, Healthy Birth Expo. We have driven Moby, our mobile health van, in the Fork Union Day Parade. We had Louisa First Responder Autism Week Festival and Get Better Crozet that we had quite a few MRC go out and just be part of the community and hand out tchotchkes and teach people about being healthy and public health. We did, for our Blue Ridge Health District Staff Day, we had MRC come in and teach our staff education. So we've done family and friends CPR and Stop the Bleed, where we've had MRC come in and do that. We do a lot of project-based chart management. So MRC will pull and package charts for retention, destruction for EH, OSS, finance. And one of our really fun programs are the Viva Go program. So that's our newcomers to our community that need a little extra help and need a little extra education on what it's like to be in America and what is required for shots to go to school or what's required for immunization health for anybody coming into the country. We have our test and go that we do monthly. We have both a greeter and a runner. So the greeter obviously greets people, brings in clipboards, does brief demographics, figures out what test each person is going to need. And they in turn would turn that over to give them a number in which they'd be identified with to go through the process. The runner is someone that works to bring the charts to the clinic area, brings empty clipboards back to the front, and may do some brief other duties to help maintain that clinic flow. We have monthly CPR certification classes. We are not MRC led on these yet, but we do have 2 MRC certified instructors that will be taking this over in the next few months. One of the really fun things that we did is we went to Western Albemarle High School and was part of their mini med school where they had MRC teach the students there Stop the Bleed and Revive. So that was very, very fun. They really enjoyed that. I do have a quarterly infant safety class that is with our maternal health department. This is a hands-only friends and family CPR that is MRC led. We have lots and lots of back to school vaccinations and health screenings that we completed, just got done with those last month. And as of last night, we did our 7th free EPNR free flu vaccination clinic. So we were pretty successful at that and did quite a few of them. Some of the things that we do have coming up, we're partnering with Charlottesville High School, the nursing department, to help with their eye testing and vaccine chart review on the kids' charts, like the charts that they have for each kid. Flu and COVID-19 vaccination clinics start up on October 21st, and those will go all the way through every Monday through December. We are helping with registration for a couple different medical conferences that are coming to Charlottesville. So that's working kind of more with our community and finding out what's coming to town and being able to help the registration for those. And one of our clinics is physically moving to another location. This will be the 2nd clinic that we've moved. We moved to Louisa, and now we'll be moving Nelson. So the MRC helped to pack, move, unpack, break down boxes, direct people during the open house, which was a lot of fun. Organize the new chart room, file, and do all those fun things. So hopefully this gives you a little idea of what MRC does in Blue Ridge Health District and has some creative ways in which all those volunteers can deploy to different deployments. That's it. That's all I have.
Thank you so much, Amy. Let's go to Kate. Other Kate.
Hi, everyone. My name is Kate Croxton. I am the Lord Fairfax MRC coordinator, and I've been with the Lord Fairfax MRC unit since January of this year. So that's kind of the timeline that I'll be talking about tonight. Lord Fairfax MRC serves the localities of the Lord Fairfax Health District. So we're up in the northern Shenandoah Valley. We cover the city of Winchester and then Frederick, Clark, Page, Shenandoah, and Warren counties. Just a little fun facts segment on like what goes on in our district. We have a lot of fun outdoorsy activities that you can do. Skyline Drive actually starts in Front Royal in Warren County for Shenandoah National Park. Luray Caverns, if you've ever been there, is in Page County. And then my personal favorite, not outdoorsy, if you've ever had Route 11 potato chips, their chip factory is actually in Shenandoah County in Mount Jackson. So that's a personal favorite. We currently have 262 volunteers, and all of them have very diverse backgrounds and skill sets. So we're really grateful for everything that they do to support our health district and community partners. So some things that we've been doing since I started. Similar to what Amy was mentioning earlier, in March, we dealt with some wildfires out in Page County that burned for several days. So even though none of our volunteers ended up deploying, they were on standby for shelter support if necessary throughout that response. Of course, we do a lot of just daily public health activities and health department support. Most recently, they've been supporting immunization clinics, specifically helping our business office staff with certain administrative tasks at back to school clinics. They also have done a bunch of filing projects. One of note that they recently finished up, they assisted our dental preventative services program with preparing over 15,000 forms to be distributed in eligible public schools at back to school events. So that was a huge lift, and we really appreciate their help with that. Of course, we also support some different community events that we have going on throughout the district. The annual Apple Blossom Festival happens in Winchester, typically from end of April, early May. We had some volunteers this year who supported the first aid station on the parade route there. And then another large event that we did earlier this year, we did some targeted outreach for Fentanyl Awareness Day back in May. So we did tabling in each of our localities to provide rapid revive trainings and distribute naloxone and other harm reduction and treatment resources in our district that are available. And I believe the count was over 70 boxes of naloxone that we distributed throughout those tabling events. And of course, we do different trainings and exercises. We typically focus on CPR. We just had a course this past Tuesday. Stop the bleed, I try to do that monthly or bi-monthly, and then revive trainings as well. And then for exercises, typically our volunteers support our community partners by acting as victim actors in their exercises. And then just one event that we're looking forward to that's coming up soon this Sunday, Lord Fairfax Health District will have their first Safety and Wellness Day event. We've partnered with over 30 organizations to help bring that to the community. We're really excited for it. It was originally planned for last month for National Preparedness Month, but ultimately got postponed due to weather. We'll have some volunteers there for MRC recruitment, just to sort of increase the visibility of our unit and chat with community members about MRC volunteers' role in promoting public health and safety and wellness in the community, and just spread the word about the MRC. So that's it for me, and thanks for your time. I appreciate it.
Great, thank you so much, Kate. So we do have two Northwest coordinators who were not able to make it. So I'm gonna toss it to Becky Chester, who is the regional coordinator for the Northwest.
Who did not test her microphone. Can you hear me?
Oh, I can hear you.
Okay. First, I just want to say I feel incredibly lucky to be the Northwest Regional MRC coordinator. I've been in this position. This is my third year now. And all 5 of our local unit coordinators are amazing. Actually, all of the local unit coordinators across the state of Virginia, and so are the regional coordinators, are amazing. And it is a privilege to work for this organization and with you volunteers and with my local unit coordinators. So Anthony Salgado is not here tonight. He was double booked. He is a wonderful human being. And one fun little tidbit about Anthony is that he has pet birds. And I knew nothing about birds until I met Anthony. And if you are one of his volunteers or you ever get to meet him, please ask him about his pets, because they are so cute and he has great pictures and it's super fun. He has been with the Rappahannock MRC for going on 4 years now. And one of his passion projects was the Rapid Revive, and you guys can see his slide up here. They cover the localities surrounding the city of Fredericksburg. Rappahannock, sorry, has about 750 registered volunteers that are ready to deploy. They build relationships with lots of different community groups. The unit has provided Rapid Revive training across the community, and they did one of the first Rapid Revive drive-through clinics, enabling a lot of people to get a lot of information and a lot of kits in their hands in a very, very short amount of time. So that was a very innovative way to get that Rapid Revive out into the community. The Rappahannock MRC assists the health district with the pod events. They just did a flu pod at the state fair and did over 200 vaccinations in a 4-hour period. So thank you to those volunteers and Anthony for getting that up and running and going. Oh, it's down there on the bottom. Those are the numbers. So that is Anthony in a tiny nutshell. I think I have one more to do after this. Yeah. Yes. So Noreen Miano also double booked for the night. She has been with the Rappahannock Rapidan Medical Reserve Corps since October of 2022. So this is her 2-year anniversary. She has a master's in Homeland Security and Emergency Preparedness from BCU, and her bachelor's actually is from the Philippines. She came to the United States in 2018, and has when she came to the MRC 2 years ago, she just hit the ground running. She had a wonderful mentor in Kathy Hatter. They cover Culpeper, Fauquier, Madison Orange, and Rappahannock. They do a lot of community events. They have really excellent partnerships with their fire, their EMS council, their Center for Aging. As you can see, in the last 10-ish months, they have done 175 people have been trained at 19 different events for Rapid Revive. They participate in the NVERS medical response and surge exercise. That was in April. We had a couple of Northwest units and a lot of volunteers that participated in that with their healthcare coalition. Rappahannock Rapidan is lucky enough to have some volunteers that are able to work with the OCME in the north, sort of a cross-regional partnership. They recently partnered with their Rappahannock Rapidan EMS Council to create a Stroke Smart and present that at community events across their region. And as most MRC units are doing, are working to support the flu clinics across the state. And that's what we have for those two.
Great. Thank you so much, Becky. I appreciate you. Okay, so now we're going to go to the north with Amy. Other Amy.
Hi, everyone. Good evening. I am Amy Feinberg. I am the local unit coordinator in the Greater Prince William MRC. So we serve the county of Prince William as well as the cities of Manassas and Manassas Park. We have just over 500,000 residents in our health district. So we're one of the largest health districts in the state. Just a few quick updates for you guys. We just hired a new health director in our health district, and I had an opportunity to briefly meet him today. And I'm looking forward to introducing him to the MRC and introducing you to him, so that he can get to know us and get to know what we do and what we do in emergency preparedness. But it also, I'm excited because it means I get to have a fresh opportunity for some strategic planning. So I want to take the next few weeks and months as we close out the year to kind of meet with our new health director and figure out a good strategic plan for our MRC unit. So if you're in my unit, look forward to some information about that. But other things that have been going on, we did our flu clinic in September. We had a couple of good clinics on both ends of our county, of our health district. And we did those with a mixture of staff and volunteers. And I'm so grateful for our volunteers who came out and helped with our flu clinic, as well as the outreach event that was focused on preparedness. I have 2 volunteers right now who are going through training to become instructors in mental health first aid. And once they get fully trained and we get some things in place, I'm really excited to offer the mental health first aid training to my volunteers. It's a full day of training, but it's so worth it. It's so valuable and so meaningful that I am really looking forward to that opportunity coming soon. We'll also have, similar to what other units are doing, things like Revive and Stop the Bleed, BLS classes coming up in the near future, which will all be led by volunteers. So I'm really excited to have a good group of volunteers who like to teach, because I don't like to be in front of people talking all the time. So I'm really grateful for that. And yeah, we just, our new health director also says he's focused on outreach and community engagement. So I think there will be a lot more opportunities for outreach events and different types of those things. We just had a really good community engagement and education team meeting today. So more opportunities for that for our volunteers. And that's all I have for Prince William. Thanks for coming on tonight.
Great. Thank you so much, Amy. All right, we're going to go now to Rosie.
Hi, good evening, everyone. My name is Rosie Nadici. I am the coordinator for the Alexandria MRC unit. Alexandria MRC only covers the city of Alexandria. It's about 15.5 square miles. It is urban up here in the National Capital Region. And our volunteers have been supporting a lot of population health activities. Recently, volunteers have been actively supporting the community health assessment, which is underway right now in the phase of gathering feedback through a survey that is given out at community events. So volunteers have been surveying as well as helping with data entry and other outreach for the health department. Volunteers have also been, they supported a kickoff event as well for that community health assessment. Volunteers also recently responded to a lead testing response in our city. The health department made available to all of the staff and students at a school to come to the health department for testing on one of 2 days that were offered several weeks ago, and volunteers came out to support greeting and flow for those testing events, as well as other preparedness outreach during National Preparedness Month. Volunteers were doing lots of outreach at farmers markets and at special preparedness events. And recently we also had a volunteer who was offered a BLS training for both staff as well as volunteers so that they could have the BLS training under their belt in time to vaccinate for the upcoming flu pod. This is an EPNR activity. We did not do the flu pod last year, so this is coming back to great excitement. Volunteers will be doing all sorts of roles within this exercise, from the vaccinating as well as all of the support staff. And we are also going to have several volunteers who are going to be serving as exercise evaluators this time around. We recently held a training for exercise evaluators, and the hope is that with time we will develop a group of volunteers who we could deploy as evaluators for exercises, either for our health department, neighboring health departments, or perhaps the long-term care facilities that our health department facilitates exercises for. And volunteers will also be participating in drug take-back events coming up in 2 weeks as well. So that's just a short and sweet what's been going on in Alexandria.
Awesome. Thank you, Rosie. Okay, we're going to go to Ada. I'm never sure how to pronounce her name. Please correct me if I'm incorrect. You are muted if you are speaking. I see her on here. There you are.
Me?
Yes.
Sorry about that. Hi, my name is Ida Seydu. I am the assistant coordinator for Loudoun. Our coordinator, Elizabeth Thurman, couldn't be on tonight, so I'll be representing Loudoun. When I joined the team earlier this year, it was kind of as the interim coordinator because the previous MRC coordinator and program assistant had both transitioned to new positions within a few months of each other. So while we were waiting for the new full-time role to be onboarded, I was kind of there as the interim, just to maintain and get volunteers onboarded, but not stretch ourselves too thin as we were waiting to get back to full staff. Since then, since we've onboarded our new coordinator, we've kind of gotten back into trainings. We've had regular CPR classes and revive classes for our volunteers. We've been going back out to more outreach events. A big one that we went to a few weeks back was the Leesburg Air Show. And we were able to provide emergency preparedness tips to the community and give information about MRC. More recently, we've had our MRC assist as general support at some COVID and flu clinics in the Loudoun community, along with Loudoun caregivers, along with some other community partners. We've had 3 of those so far this fall, and we have 1 more coming up in November. And then we have our flu exercise clinic this Saturday, actually. And we've been preparing for that for a long time, it feels like. So glad the big day's here. We have about 30 plus volunteers that will be supporting us in both medical and non-medical roles. And that's all I have for Loudoun. Thank you.
Great. Thank you so much. My apologies for butchering your name. And now we're going to toss it to the regional for North, who's Madison Davis. We have a couple folks in North who also weren't able to make it today.
Good evening, everyone. My name is Madison Davis. I'm the Northern Region Medical Reserve Corps Coordinator. I've been in my position for just over 2 years now, and would like to just echo what Becky said in just the great team that we have across the state. I mean, personally speaking, I think that North has some of our best folks. So thank you so much, Amy, Rosie, and Ida for taking the time to be here. Unfortunately, Paula and Gulira out of Fairfax MRC are currently supporting an in-person regional training tonight and couldn't be in 2 places at once, so I'm here to support them as well. Gulira just recently started the team at Fairfax MRC as the assistant coordinator. She's actually a medical professional from Kyrgyzstan. She's worked with the Fairfax County in a couple different positions, including the Department of Family Services, Domestic and Sexual Violence Services. And so she's been a great help and a great asset to the team, and it's absolutely wonderful having her. Paula has been around. She's almost at 10, it'll be 10 years next year, so we're really lucky to have her with us. She is a certified volunteer administrator and just an amazing person as well as volunteer coordinator. And they've been doing a lot of really amazing work in Fairfax. You can see their bios there, but if Kate can move to the next slide, we can see a little bit of what they've been doing in Fairfax as well. They have been very busy. They have over 2,000 volunteers, and they've been doing a lot of outreach, working with the health department and various trainings as well that they've been able to open up regionally. They have had a series of volunteer safety and security trainings, not just active shooter trainings, but also de-escalation and overall recognition of site safety and some of those great things. They also have partnered with a local educational program to bring American Sign Language, both basic and intermediate, to their volunteers for free, as well as things like Stroke Smart, autism disasters, and some other cultural trainings as well. And then I guess I can move on to Arlington as well. That Mike Fletcher and his assistant Desiree Gonzalez Vargas were also unable to make it tonight. But they have been very busy doing a lot of great things like Fairfax. They've also been partnering with their local public school system to offer vision and hearing screenings throughout the fall. It's something that Arlington used to do, and now that they've moved out of COVID operations, they're able to get back to it. They've also had volunteers supporting their WIC office, as well as their parent-infant education initiative. So really great community work there as well. I also just would like to take a moment to talk about the challenges of being in Northern Virginia, something that all of these coordinators have had to face and risen to the challenge of. We do annual regional deployments to the 4th of July with medical volunteers supporting aid stations there. We're anticipating having a similar deployment to inauguration, which is something we also do every 4 years, although during COVID, that was scaled back and we didn't end up supporting then. We've been working with ENVERS to support their medical response and surge exercise like we did in Northwest, Becky mentioned as well. And we're also going to be sending volunteers, registered nurses actually, to support the Marine Corps Marathon as well. So we do a lot of great regional work up here. We are a team because we are all so very close together, both emotionally and physically. And I'm just so proud and so astounded by them every single day. And I'm just so glad that I was able to bring you those who couldn't come. And I'm so glad that Amy, Rosie, and Ida were here to represent their units as well. Thank you very much.
Thank you so much, Madison. I appreciate you doing that for us. So now we're going to go to the east, and I realized that I did not introduce myself at the beginning of the session. My name is Kate Bausman. I am the regional coordinator for the Eastern region. So we're going to start with Jonathan. Jonathan, did you get your technological issues sorted? See him on here.
Can you hear me?
There you are.
Kate, can you hear me?
Yes.
Okay, good. All right. I've been having some technical difficulties. I apologize. So good evening, everyone. My name is Jonathan Matthews. I am the coordinator for the Three Rivers Medical Reserve Corps. Three Rivers it encompasses 10 counties. It is comprised of about 140,000 people, and it is primarily rural. From Gloucester County in the south, just north of Yorktown, to Westmoreland County on the Potomac River. I started this position back in July of 2022. My background prior to this was fire, EMS, and security, and my area of study is government and national security. And then I was also an MRC volunteer for a few years prior to coming onto this position. The mission of this MRC unit in particular is to augment and assist community operations during large-scale emergencies and to assist the community's public health care needs. So to that end, one of our big goals over the summer was to establish and refine a more dedicated MRC first aid team in our district. So we were able to train a more specialized group of MRC volunteers to support that team and that mission, and we were able to procure some new equipment for that as well. So that was a big accomplishment for our unit. Over the last few months, we've been very busy with flu clinics and with community-facing CPR classes. A lot of those classes have been through the Compress and Shock Foundation and also donating AEDs to the community, which is a very big win. Our ham radio team has been very busy over the summer, improving our equipment and maintaining our equipment, which for large storms, ham radio is absolutely critical for communications for hospitals and other big organizations and state agencies, so that's been very good. Moving ahead, we are looking forward to an increase in available trainings over these winter months. And then we are also looking to increase our visibility and our impact by establishing new relationships with community partners and then maintaining relationships with recent and existing community partners, such as our local free clinics, CERT teams, healthcare coalitions, and our community services boards, which we have been sporadically supporting throughout the year. So what this is going to look like in practice moving forward is greater collaboration, more requests for volunteer assistance towards community-facing services, and more mutual trainings for their staff, for VDH staff, for MRC volunteers, and the community as a whole. And this is going to continue to be a primary goal for this MRC unit moving into 2025. So, of course, I'm super, super grateful to all of our volunteers and also to those volunteers that have taken time to engage in training and to be part of specialized teams as well. Thank you, everyone.
Great. Thank you so much, Jonathan. I'm glad you got your technological issues sorted. Now we're going to go to Rebecca.
Hello, everybody. I am Rebecca Friedlove-Berry. I'm the proud unit coordinator for the Peninsula Medical Reserve Corps. We are from Hampton all the way up to Toano, just north of Williamsburg. I'm sure many of you have come to visit us. We've got quite a lot to do in our area, and if you haven't checked us out, you've got to come down to Williamsburg and York County and come visit and see the leaves changing here. The Peninsula MRC has been staying busy as usual. Today was the Great Southeast Shakeout. So our MRC unit, we participated by having an exercise drill, and here at the health districts, we all at 1017 got underneath our desks and practice. You know, my plug is, yes, we live in the Southeast, but earthquakes can happen anywhere, so please be prepared. There's my little plug for today. We have used the last 2 ORA grants to train ourselves and to train our staff and MRC in AVERT, which is Active Violence Emergency Response Training. So far, we have trained 150 staff and volunteers in AVERT. We are partnering with the Compress and Shock Foundation again. In June, we provided the training at 2 local sites, and this coming Sunday is another Compress and Shock Day. We're training at 2 churches, one in Hampton and one in Newport News. Every month, the Peninsula MRC, we lead a virtual revive. Tanya Heron, I believe I saw her name show up on the participant list. She and I provide this virtual revive to our community. Folks can just log in, take the class with us, and then we make arrangements for them to come into the health district to pick up their kits that following week. It's been incredibly successful, and we're very proud of that project. We do teach a lot of revive here on the peninsula. We teach full-blown classes, and we also do a lot of rapid revive along with the community health here. Back in June, on the 29th, was our Hampton Peninsula Health District's Health Expo. We moved into this beautiful new building and we wanted to open it up to the public. We had over 99 volunteer hours for this one event. Leading up to the event, we had volunteers out canvassing the community, taking flyers and promoting, and we ended up with over 300 visitors that day with 40 vendors. We had a kids corner with games and face painting. We offered trainings, school physicals, vaccinations, A1C testing, HIV, and blood pressure. We do have our flu vaccine clinic coming up. That's going to be on the 26th, the Saturday before Halloween. We're going to have it as a drive-through clinic, so we're hoping folks will come through, get the shots in arms in between their little Halloween festivities. I'm so proud of what the Peninsula MRC does. Our volunteers are beautiful, wonderful, kind people, and I couldn't be more proud.
Great. Thank you so much, Rebecca. I will also say that Peninsula Health District was gracious enough to host our Eastern Region Training Day in September. It was a wonderful experience for about 50 volunteers came. We all had a really good time learning and eating delicious lunch. So now we're going to go to Brianna.
Good evening, everyone. Thank you all for joining us tonight. Forgive me because I'm reading my notes because I don't want to be rambling all night. But I am the Norfolk MRC coordinator. I think we're awesome. So any of my Norfolk people here, thank you guys. So some of the things that we've been doing some revive training. We had a couple of MRC volunteers do some revive training for the juvenile detention staff, which was really cool. Big thanks to everybody that participated in the back to school clinics. We literally could not have done it without you guys. So super, super grateful for that. We were invited by the Norfolk Zoo to do Senior Wednesdays at the zoo, which was about 5 or 6 Wednesdays where we just went and talked about the Norfolk Health Department, what MRC is, and recruit some people. Really great event. We did have our Eastern Region Training Day, which was awesome. Thank you guys for coming to that. We did some partnership with the DoD doing an active shooter exercise recently. We partnered with Virginia Beach doing their shelter exercise, which was really cool. We had some MRC come out to the Old Dominion University Experience Fair where we reached about like 550 students who were interested in volunteer opportunities. I think that was amazing. We got a couple of people sign up. So really excited about that. Just a couple of weeks ago, we had our Save a Life Day where we visited 4 colleges and we distributed Narcan, did Rapid Revive. I think we distributed over 100 kits. So that was really exciting. We have our flu exercise tomorrow at Norfolk State University. We've done some flu and COVID clinics with Norfolk Fire and Rescue, and then we have some coming up with Hampton Roads Transportation. Down the line in the future, we have the Tattoo Festival at Norfolk Scope, which a lot of you guys, it's a regional thing, so we have people come all over. We are doing it again next year. I had a couple people ask me about that, so super excited for that. We have the Norfolk Holiday Parade, which will be Thanksgiving. We're participating in that, so we'll be looking for some MRC volunteers if you want to come out and walk with us in the parade. We will be having an upcoming Meet the Coordinator. I'm approaching my 1-year mark as a Norfolk coordinator. So super exciting. I will be hosting a Meet the Coordinator evening, just come and chat and introduce myself to you guys in person. I'll also be starting a monthly newsletter. So just look out for that. It'll just give some information of upcoming events that we have, things going on, ways you can help out. And we will have another Eastern Region Training Day in February in Norfolk. So I hope to see you guys there. That is all that I have. If you guys need me, feel free to reach out anytime. Thank you so much.
Thank you, Brianna. I appreciate you. Now we're going to go to May.
Hello, everyone, and greetings from the beautiful city of Virginia Beach, the largest resort city there is in the world. Thank you so much for taking the time to hear me, and I thank you, Kate, and all of you MRC coordinators. I am a program assistant for Virginia Beach, and our new coordinator is actually Harrison Wattis, and he could not be with us tonight, but I am sending some notes, or we got together and collaborated some notes about what we're doing. Actually, with a program called the Newcomers Program, where our licensed providers support us by delivering and giving health exams, health screenings to our newly arrived, our refugees, and other qualified individuals. Then in March, our awesome volunteers supported the annual Shamrock Marathon at the Virginia Beach oceanfront. Our volunteers were so very supportive in helping us in this event. They handed out water cups and they took down and set up the necessary secured areas. They also assisted us at the Celebrating Children event, which is an annual community event. Lots of fun and games, dental screenings, information on child abuse programs, free resources on social services programs. They were awesome. Our volunteers are excellent, as well as the whole state of Virginia. VBMRC volunteers also helped with the Special Olympics. They helped special needs children in participating in different sports and other physical activities at the Special Olympics. Another thing our MRC did, actually, there's one particular MRC who has been dedicated to N95 fit testing for the N95 mask. Some of our lab workers wanted to make sure they get the right mask. So when they're working the labs, so he's been doing that along with the Stop the Bleed training. Our volunteers also assisted at the monthly mental health wellness program that was requested by the City of Virginia Beach City Manager's Office. They helped with registrations. They helped with setup and takedown at the Meeting of the Minds Wellness event that was also held there down at the Municipal Center for the City of Virginia Beach. And then concerning our back to school immunizations, our Virginia Beach, Medical Reserve Corps volunteers, they were awesome. And just to give you a little bit of highlights, we vaccinated 1,559 children, and there was a total of 3,257 vaccinations that were actually provided, which is a 48% increase from 2023. I think that was great. Now, last Saturday, we were at the Philippine with vaccinations, vaccination assistance, patient monitoring, and registration. And lastly, let me just mention this. On Saturday, yes, October 19th, this Saturday, if you're in the area, come by Green Run High School. We have an event called Flu X, and we have not done this event since, well, prior to COVID. We did it and before COVID, but now we're starting it back up. And this Saturday, we're going to do it at the Green Run High School here in Virginia Beach. And we're going to get out there quite early, 7:30. We're going to be there. Our MRC volunteers are geared up to help us. And we're looking forward for a successful, wonderful event. Thank you so much. I appreciate all of you. I love listening to all the stories. Everything was so interesting. Thank you.
Thank you, May. I appreciate you. So East also has a few people who weren't able to make it today. Excuse me. So first is Darlene Delklin from Portsmouth. She has been the unit coordinator for Portsmouth for just right out a year. And she is a super duper trainer extraordinaire. Any type of training that she can become certified in, she will do it. She's a Stop the Bleed trainer. She's a CPR instructor. She is kind of out of control in a really good way. And she has really, really done a lot to revitalize the unit. They had been without a coordinator for a while. So they have been doing all types of things, first aid for runs and walks, community health assessment, lots and lots of Stop the Bleed training, lots and lots of CPR training. She's gone into other units and done Stop the Bleed for them and for staff at other health districts. She has just really gotten them out there in the community, lots of Revive trainings as well. And I don't see her slowing down anytime soon. So we're really excited about Portsmouth. And then Ellen Archer from the Eastern Shore. Ellen has been the MRC coordinator on the Eastern Shore for a very, very long time, 17 years. And they were recently, very excitingly, their unit was featured in the National MRC newsletter. And she said, "We're small, but we're feisty." And I think that really, really sort of encapsulates the Eastern Shore unit. They have 157 volunteers, right about half and half, medical and non-medical. And they're right there on that sort of whole Eastern Shore situation. They do lots of things. They do pony swim where they do first aid. They sometimes go out to the beach and hand out sunscreen and water. They just did Stop the Bleed training for the NASA facility, which I thought was super cool. They do their last big event of the year is a 100-mile bike tour where they do first aid units and volunteers for that. They do lots of training. They've started doing a lot of Revive, and they continue to do lots of Stop the Bleed as well. I love that free sunscreen picture. And then Kayla with Chesapeake. Kayla has been with the MRC since the fall of 2021. She started as a COVID volunteer. I think some other folks can say that as well. And she has been running the unit since then. She keeps her folks busy as well, doing lots and lots of community partnership stuff. They're one of their biggest missions that they have been doing for a couple years, and they do all of the time, is they assist Healthy Chesapeake and the 4Kids shelter with meals. They are doing exercises, they're doing some Revive training, they did some immunization stuff. And we also, just as a region, we do a lot of regional supporting of each other. So if there are events that folks have that they do not have enough volunteers for, all of our other unit coordinators are super happy to jump in and say, yes, I'm happy for you to send that to our folks to see if they would like to participate, because we really like to keep our folks engaged. And the other unit, which I do not have a slide for, is Western Tidewater. They currently do not have a coordinator, but they just hired a local health emergency coordinator, which is a position that supervises the MRC coordinator. So we're hoping that they will be able to bring somebody in soon. We do also always have folks, when I send out regional deployments from Western Tidewater, we always have folks from regional deployments, we always have folks from Western Tidewater jump in and want to participate. I think we're sending 3 Western Tidewater folks to help Darlene on Saturday with their flu exercise. So we appreciate you guys so much. And that's the East for y'all. So we're going to go ahead and move to Central, and we're going to start with Alyssa.
Hi, everyone. I just want to first say thank you to everyone who's on the training and the call tonight and being able to hear the wonderful things that our whole state's doing. So thank you so much for being here. My name's Alyssa Lewis. I'm the Greater Richmond Unit Coordinator. So Greater Richmond, we encompass Richmond City, Henrico County, and then the counties of Goochland, Hanover, New Kent, and Charles City. I've been the unit coordinator since April of 2018. So I'm one of the old folks now, I guess. Fun fact just about our unit, not about our area, but we used to be, if you've been around for a while, you may recognize Henrico, Chickahominy, and then Richmond City, but we became a super unit during COVID, and then we officially merged together. So now we're Greater Richmond. While other areas were separating, we got the crazy idea to let's just make one big happy family here. We have a little over 3,000 volunteers registered in our unit. Population-wise, a little over 700,000, I believe, between the 6 localities. Some cool things that we've done in the past year. We have great partnerships with American Heart Association, where we partner with them and food banks and the YMCAs to do blood pressure screenings for their clients coming in. We help with the Special Olympics Summer Games. We've been doing that. I think Richmond City started doing it before we were invited to join them. So that's like 2017, 2016, I think. And we've been doing it almost every year since, where we help with their Healthy Athletes Center, where the athletes and parents or coaches, they all come in and we teach them healthy habits and do their blood pressure and things like that. So it's a really cool opportunity. We love doing it. This year we had our radiological exercise in Hanover. So we had volunteers, and shout out to the 2 volunteers. I believe one was Virginia Beach and Lord Fairfax. They were wonderful. They came and helped from the state radiological MRC team do a evacuation assistance center evaluated exercise. And it was a lot of fun. We had quite a few volunteers help inside and as role players. So it was kind of cool to see that whole operation. We do a lot of regular things that everyone else has talked about: seasonal immunizations, COVID immunizations. We've had a few recently, more Mpox clinics, getting back into that. We have a refugee clinic that our volunteers help out. at just the regular cool stuff. In the future, we're looking to form more partnerships, like with Richmond City is a stroke smart city. Say that 3 times fast. So we are partnering with that initiative for volunteers to provide education to the community about stroke and what Stroke Smart is. So that's coming up. We're really trying to build up our training plan to provide more trainings for our volunteers. So if you're from Greater Richmond, look out for a survey coming soon about what you guys would like to see also. Recently, the Chesterfield coordinator, I became psychological first aid trainer. So we're starting to provide that to our volunteers as well, which is a fun, long, but fun course. Like I said, just building partnerships, getting out in the community more. And that's kind of where we're at. So thanks, everyone.
Thank you, Alyssa. Now let's go to Sarah.
Hello, everybody. I am Sarah Gagnon. I am the coordinator for Chesterfield Medical Reserve Corps. Here in Central, we do a lot together. So Alyssa, it's kind of funny, Alyssa just went before me, but if you've been to any of our trainings, you've probably seen Alyssa and myself together. We train a lot together. And I don't know if Robin's on here tonight, but Robin and I also do things together often. And Felicia and even Amy, who's not Central, but we try and work together. So I love the community of that we're in both volunteers, because it's fun to meet volunteers from both my community, but other communities as well. And the last year, so I've been here just over a year, but in the last year, we've been really busy. It's fun to see that like a lot of us are doing the same things. So we're, with the support of the health department, getting those immunizations, getting those kiddos, the physicals they need and the immunizations they need to stay in school. The newcomer exams, Revive, if you haven't noticed, there seems to be a definite trend among Virginia to get that Revive training out there and get Narcan distributed among more and more people. So supporting health department initiatives, getting those vaccines, trying to remember back to school events. We also have been fortunate, Felicia, who's on here, will talk probably after me, but to do a CPR, we have a RQI, which is resuscitation quality improvement. So we've had the opportunity to test a new way to get certified in CPR. And so that's been really fun and interesting. I think that's about all I have. We are, looking to do more training, focus on training, psychological first aid, building out that behavioral health team. I know Stephanie Waite has the state level behavioral health team, but a lot of us are looking to do that at the local level. So we've been really busy, over 400 hours already this year that my volunteers have put in at the clinic, as well as over 800 vaccines that we did for back to school. So all exciting stuff. Thank you, Kate.
Thank you, Sarah. Thank you so much. Now we're going to go to Robin. Is Robin here? If not, I do have a slide for her who I can slide in at the end, but thought she was going to come. Nope. Okay, well then let's go to Amanda. Mandy.
Hey guys, you better be glad it's dark because my background would be a horse, a goat, and some chickens right now if y'all could see it. But I'm the Southside coordinator. My district just covers 3 counties, Halifax, Mecklenburg, and Brunswick. We're a very rural area. I've only been a coordinator with us since February, but I can see that I've had some awesome volunteers because without them, I wouldn't have been able to do all the community events that we've been able to do. And I'm going to start with that because that's my favorite, because I always love to go. We always love to play the game, What's in the Kit, and the kids and adults love guessing to figure out what they need to find in the emergency kit. And it's a great way to introduce them to making sure you have an emergency kit and reminding them that they need cash. A lot of people don't carry cash anymore. We've just been going out like everyone else, helping with Revive. We've been trying to provide those out in the community. We've been doing some rapid revives. Pretty excited. We've partnered with one of our towns. They're doing a substance abuse walk. So during that walk, we'll be providing rapid revive with our community service board. We've just been helping out with some wellness fairs. Had some great volunteers come out and help teach a rehab facility how to make sure to properly be hygienic with their job and everything. Help with food truck inspections so far this year. And we're trying to get our CPR instructor certifications down here in Southside, but we're all the way down here in North Carolina almost. That's all we've been up to.
Great. Thank you so much, Andy. And let's go to Felicia.
Hey, everybody. I'm Felicia Mans. I'm the Piedmont Medical Reserve Corps Coordinator. We encompass 7 counties. That's Amelia, Buckingham, Charlotte, Cumberland, Lunenburg, Nottoway, and Prince Edward. My previous life was 30 years in the fire service, so I've got a lot of background in preparedness and ICFs and all that jazz. I was a medic and a captain. Recently, myself and my assistant, who's not on tonight, Cassie or Cassandra Hurt, she and I both separately did church health fairs that they were having and they requested us. And they requested us to do just a snippet, not a class, on preparedness, stop the bleed, revive, CPR, just an overview. We did our EPNR COVID flu shot event at the beginning of this month. And I think we got like 66 flu shots and maybe 30. It was out in Buckingham, Virginia. We recently, just last week, did a DIY day where they make your own they teach people to make their own air purifiers with a fan and 4 filters. And then a lot of people like that and some duct tape, and it's a lot of fun. We do hand soap, and they did Revive, and I did the Until Help Arrives. We didn't get a chance to do Stop the Bleed for that one. That was in Pamplin, Virginia. I just recently finished my CPR instructor class. Woohoo! I had it years ago and let it lapse when I retired. And a lot has changed, but I'm back in the swing again and we'll be teaching. I got into the office today and got 2 requests back to back. You know anybody who can teach CPR? Anyway, I'll be working with that. We just recently did Fire Prevention Day out in Nottoway County in Burkeville. And our MRC vaccinators were on hand, and we were doing our first flu vaccines from leftover EPNR flu vaccines, but we didn't really have anything happen there. Let's see. I put in 1 junior MRC, 6 adult volunteers, and 1 partner for the Virginia Volunteerism, the Governor's Volunteerism Awards. They were not chosen, but they will be in the January or February list of people who are going to be recognized. So all of my folks are going to get recognized. One of the partner is the Piedmont Senior Resources. They do the cafes with all the seniors. They do a wonderful job out there in the community with the seniors. They bridge that gap that the health district does not necessarily always hit. My assistant Cassie is working on our newsletter. We're going to try to do that monthly. As Sarah mentioned earlier, we had the RQI CPR machine first. They want to send it back to us because we had a lot of people who were not expired and they didn't want to take it right now. So they may take it in the spring. We did the Cumberland Elementary School back to school night. And it was at the elementary school, and that's where Cassie actually does her day job. And so a lot of times she can get us in on a lot of stuff that we wouldn't have necessarily known about. We signed up 2 people there, a daughter and a mother. Mother works there. So we've got 1 junior and 1 adult volunteer. We've got to get them through their process. Let's see. And next week is the Cumberland Public School, but it's at the elementary school, Fall Festival. So apparently they're gonna have food trucks and all this other stuff, and we're doing s'mores and hot chocolate. So we figured everybody want to come to our tent, and we're gonna try to do like a game show with our prize wheel, and kind of like we're gonna do our Vanna thing and do Wheel of Fortune. So that's all I have right now. I'm sure I'm forgetting something, but that's all we got going on in Piedmont.
Thank you so much, Felicia. I did find Robin's slide. Abigail, are you on the Central Region Regional Coordinator? I think I'm sharing the wrong thing. Hold, please. Okay. Can you see the Robin slide?
Yeah.
Perfect. Great. So I don't know a ton about what goes on in Central, but I can try. Robin has been an MRC coordinator for Crater, which includes Emporia, Hopewell, Petersburg, and the counties of Dinwiddie, Greensville, Prince George, Surrey, and Sussex. She's been the coordinator for 2 years. And like much of the rest of the units across the state, she has been doing lots of medical and general support volunteers for resource fairs, which she's been doing Rapid Revive, blood pressure checks, first aid stations. They've been doing a lot of recruitment down there in Crater as well. First aid stations. Let's see, they did a Cinco de Mayo event, a Stop Gun Violence event, all kinds of community activities. And they are doing food distribution, a men's sexual health clinic on the regularly, and they support WIC regularly as well. And we look forward to seeing what they do in the future. So I did a really bad job of stopping for questions. Does anybody have any questions or comments for any of the coordinators or the regionals? Yes, Madison, you are correct. Any questions?
Hey, can you mention Abby's, what she's doing? Everyone may not be able to see the chat.
Yes, so Abby, in addition to being the Central Region Coordinator, she's also on the COVA the Commonwealth of Virginia Incident Management Team. And so she has been supporting that mission out in Southwest Virginia, and then also now in Richmond in the Emergency Operations Center with Helene response. So she's been extremely busy with that for the last couple weeks. And our program assistant as well, Laura Cash, has been supporting the EOC in Richmond for the last couple weeks as well. I'm just trying to find this very last slide here, and then I will let you all go. Here we go. So any questions, comments, anything like that, please jump in the chat or let us know. So the very last thing that you need to know is to
Something. I think this was very exciting. It was a great idea to do this, and I am highly impressed. Thank you so much. I get to see the faces now of so many people, and of course you get to see mine, but thank you so much for having this time and being able to do this, on this scale. It's been very nice, and I just wanted to say thank you. Thanks to everyone.
Well, thank you, May. I'm so glad that everyone was able to participate.
Yeah.
We have a lot of really amazing things going on in Virginia. I know after COVID, we thought there was going to be a slowdown. And while there was a little bit of a slowdown, I don't think it's, really slowed down too terribly much. So